Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video we're going to go over 5 tips on transitioning from student to nurse. Now, I remember being a nursing student and how nervous and scared but excited I was to become a nurse. But I knew from other people I had talked to and just knowing from being a student to a nurse that things were going to be a little bit differently. I was going to have a little bit of a learning curve and I was going to have to transition. So in this video, I want to give you 5 tips from my personal experience that I think can help you nursing students who are fixing to graduate and work as a new nurse graduate, or even you pre-nursing students who are going to go to nursing school. And this will just give you some tips on what to expect and put some things in the back of your mind so you can be prepared. So let's get started. Okay, tip number 1. I think that it is so important that whenever you're transitioning from student to nurse, whenever you become a nurse, that you work really hard at facilitating a good rapport with your coworkers. Now, whenever you're a nursing student in clinicals, you're not really forming bonds or relationships with people who work on the floor because you're in a lot of different other clinical settings. You've probably only seen them like once or twice, so you don't form a bond with them, and they don't really know your work ethic and how well you work with others or that you're a team player, team worker. So whenever you become a new nurse, I really recommend that you really put yourself out there to your colleagues and try to get along with everyone. Help them if you see them like they're having a really rough day, they've had a code or they're really behind and you are caught up on your work, ask them if you can help them. That goes a long way. I've had a lot of times if I was behind in my work, if someone who is new, a new nurse, comes to help me, that just shows me, hey, they're a team worker, they're serious about helping people, and it just helps form a relationship. So I recommend that you facilitate good rapport with your colleagues because it'll pay off in the end. It'll help everyone work together more cohesively and make a better work environment. Okay, number 2, learn how to communicate with doctors early. For me, this was one of the things I had trouble with. As a nursing student, you're not given a lot of opportunities to talk with doctors, to call them and tell them, hey, something's going on with this patient or I need an order for this. You're not really given a lot of opportunities to do that unless you jump at it and you ask your preceptor, whoever you're with, hey, I'm going to call the doctor. I want to talk to them, or approach them on the floor to ask them about your patient because you feel a little incompetent because you're like, how about they ask me something I don't know? And I'm literally going to look at them like a deer in the headlights and be like, I don't know, so you get a little bit nervous, but some people don't have that problem, but I did. So I really recommend to help you overcome that problem that in clinical time, as a student, if you still are a student, that you try to step up to the plate and ask if you could call the doctor or approach them on the floor to ask them a question that you and your preceptor was needing to ask the doctor anyways. And then whenever you become a nurse and you're in orientation period, that you really take time to work on those skills, because whenever you're a nurse on your own, it's so important you know how to communicate effectively with a doctor so you can get proper care for your patient. Okay, tip number 3. Learn your employment policies and protocols and where to find them. As a student, like I said, you've been at probably many different facilities. Chances are you haven't been at the same hospital system, or maybe you're moving after graduation, or whenever you're a student, stuff happens so fast, you're going here, going there, and you don't really know that there's policies and protocols, because if you're with your preceptor, they may be doing a certain thing and they're not telling you that they're following this protocol because they don't really think to tell you. But every system has a protocol and a policy for procedures, for medications, for drips, and everything like that. It makes your life so much easier. So whenever you become a nurse, transitioning from the student to nurse, whoever you work for, make sure you know where to access those policies and protocols, because it's going to help you in the long run, and even print them off. A lot of times I recommend to people I've precepted that they get a little binder and you put all important documents, no patient information in it, of course, but you can put like hospital policies and protocols in it. So you can keep that with you the first couple months that you're on your own, and you can literally like keep it in your MAC cart if you have any carts. Some facilities have carts, and just put it in your cart, and if you need it, you can reference to it, because a lot of times you're going to be hanging, depending on what type of floor you work on, you'll be hanging like drips, giving blood, giving certain medications, how to perform certain procedures, and you don't do it all the time, so you need to brush up and make sure that you're following hospital protocol and hospital procedures, and you can just flip through that. So I really recommend that wherever you work, you look and find where these things are so you can help yourself. Okay, tip number 4. Know where to find resources. Whenever I'm talking about this, I'm talking about know where to find phone numbers, who's over this department, who do I contact if I need this, any support you're going to need. For instance, whenever I was a new nurse, I had to access support, and in nursing school, for some reason, whenever it was my turn to do that, we didn't have any ports to access, so I didn't really get that. And it had been a long time before I had access support, so I was able to call our educator, and luckily, because I had my resource page, I knew who the educator was, and she came down and walked me through accessing a port and helped me, which made me feel more comfortable. So always know who your support system people are to go to. And outside departments. So why is this important? Now, whenever you're a student, you don't really, you're not going to probably be using the phone a lot. You may answer the phone if no one else can answer it. Or some systems, they don't have a phone that they use a lot. They use what's called a vocera, which is a thing that's clipped to you and you talk into it. And it's really neat. It just transports you to whoever you need to talk to. And you're not really using these a lot. So whenever you're new to any place, you need to know how to get a hold of people, because that is one thing as a nurse I didn't really realize that I was going to be doing a lot, is calling people and getting a hold of the right people I need to get my job done. Because you have so much available to you as a nurse, and if you know who to get to or who to call or who to ask a question to, it's amazing. So I recommend either you put the phone numbers in your smartphone so you can just pull it out and find the number, or you print it off, put it on the back of your name badge, something like that. Because a lot of times you're going to be calling outside departments. For instance, say I worked in an outpatient center and we would have patients come in from the nursing home to get a procedure done, but we would have to call EMS whenever we were done. So I had to know which county for the certain EMS I was going to have to call, and if I didn't have my resource list with me, I'd be looking forever trying to find it. And sometimes Google doesn't work, so always make sure you have these available to you. Makes your job so much easier. Okay, and number 5, I want to end with this. Give it time. Whenever you are a student, you already have enough on your plate. You're trying to get through school, you're trying to get clinicals, you're trying to prepare for NCLEX. And then you become a nurse, and it's like a whole different ballgame. You are literally in information overload. You're thinking to yourself, man, how am I going to learn all this stuff? There's so much to learn. And let me tell you, it is completely normal. Whenever you're transitioning from that student to nurse, it is so normal to feel like, wow, am I ever going to get this? But trust me, after time, you're going to look back 6 months. I say give it 6 months, and you're going to look back at yourself where you were 6 months ago, and you're going to say, wow, I got this. I understand this. That girl on YouTube, she was right. So give it time. It's so important, and I promise you will finally get it. Don't beat yourself up if it's 2 months out and you're still confused. There's still some things you don't know, because it's normal. It's so much material you have to know. It's new for you. It's a little bit out of your comfort zone, some of these things, but seriously, you're going to be doing it over and over, and it's going to become second nature to you. So give the transition period time. Okay, that was 5 tips on transitioning from a student to a nurse. I hope that helped you out, and I wish you the best success in your new nursing career, and thank you so much for watching, and please subscribe to this YouTube channel and have a great day.